information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lando with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
A very pleasant good morning to you. It is another Wednesday, and we are on the big station. We are Jolly's Pharmacy crew, and it is another opportunity for you to tune in, be educated, be informed. It is a lovely Wednesday. My name is Jacinta, and our chief host, Mr. Lando, is still not back as yet. He's still enjoying his vacation, relaxing, not thinking about work. And co-host Trudy Christian is also out today, but we still are going to have a very packed and informative show today. So good morning again to you. I have with me my coworker, fellow pharmacist, Leona Jeremiah. Good morning to you.
Good morning, everyone. It's great to be on here today while we continue to expand the mind where health is concerned. So, we're going to have a great show today, and I'll leave Jacinta to also introduce otherwise.
Yes, so we will be having a guest, but before we go into our discussion for today is International Tea Day, and at all of our branches, we have co-workers pouring some tea bags for you. You know, we as a Caribbean people, we value our tea, and we don't just drink it in the morning. It's morning, noon, and night in between with meals for treating ailments, or just feeling the lovely effects of the tea. Can be very calming as well, and can also be used to treat different conditions as well. So we love our tea. So if you come onto any one of our branches, please sample the different teas available, and you can actually purchase an entire box of whichever flavor you desire. Okay, so today's discussion is about lupus, and I do not feel like lupus is being discussed as often as it should be, and many of us still are not sure as to what is lupus, how prevalent it is in Dominica, and so this will be our discussion for today. So our guest for this morning is Miss Glorine Thomas. Good morning to you.
Hi, good morning, everyone.
Nice. Welcome to Health Vibes. I'm sure you've been on with us already.
Yes.
Yes. So she's no stranger to Health Vibes, and she's no stranger to Jolly's Pharmacy. She has been a loyal customer of ours for many, many years. So she's family. Basically, she's family.
Yeah, by right, I'm family. Johnny is my family for true.
Indeed.
Yes. So welcome to Health Vibes, and thank you for joining us. Glorine is the CEO and president of Dominica Lupus Foundation. So, and she's also founder,
Yes.
right?
Also a warrior.
And a warrior, for a fact. I won't say survivor, but she knows about lupus, and she will be engaging us and also our listening audience and those viewing us on live Facebook. Welcome. We always appreciate you. So she'll be sharing her personal life experience with lupus, talking about how she was diagnosed, how she lives with lupus, and advice to those who have been recently diagnosed, and share some tips. Okay, so first things first, what is lupus?
Indeed. So, lupus is a long-term chronic disease, and it's an autoimmune disease, which basically means your own immune system attacks your body and your healthy cells. Now, lupus in itself is something that needs so much more attention, because there's a lot more studies that need to be done in terms of what exactly causes lupus, and if there's some way that we can come to a cure. So right now, lupus can cause chronic inflammation. So what it does is, when your immune system attacks your healthy cells or your healthy tissues, it can attack your different organs. It can attack your liver, your kidneys, your brain, your heart, your lungs. So persons with lupus can experience a myriad of different things, and every lupus warrior may be going through different types of symptoms or different how you call it, in lupus itself. There's so many different ranges of what can happen to you. Each warrior has a different story, and we'll learn about that later when Glorian speaks to us. Now, lupus in itself, a lot of persons who do get lupus will mention that they're having a lot of inflammation of the joints, and lupus can come with a lot of pain as well. Pain, fatigue, all of these things. Now, lupus is something that we do not know the exact cause for. And that is what makes it such a sneaky disease. And it's one that can happen to really much anyone at any time. Now, usually it's between the ages of 15 and 44 that persons may get diagnosed. And because it's such a condition that has a broad range of symptoms, you can get misdiagnosed for many, many different things before you actually get a lupus diagnosis. It can take, on an average, as statistics say, up to about 6 years for someone to get diagnosed
Properly
correctly with lupus, as it presents as so many different things. With lupus as well, it can attack your skin. So a lot of times we hear about the lupus butterfly that comes around the cheeks, and you kind of see that inflammation of the skin there, although you can have lupus without it. So again, very, very sneaky disease.
Okay, so yes, that was a mouthful, a very precise information. I want to echo that it is an immune disease, a chronic immune disease, where it's, as Leona rightfully says, it affects our own cells and tissues. And we know the immune system to be the one to protect us
Right.
from diseases, from infections, from viruses, from bacteria. So imagine your own immune system, which you are relying on to indicate if something is wrong with us, to protect us, is actually doing the harm.
Yes.
Very much so.
And because it is attacking all those different cells and tissues, inflammation comes about. And like Leona says, because of that inflammation, all many of our organs are affected. I want to
Not the whole entire body.
well, yes, of course, it's being affected in one way or another. Leona mentioned that not any two individuals experience the same symptoms. And Gloria, this is where I want you to come in. Tell us a bit about your early symptoms, or what you realized very early, and something triggered you to say, hey, something is wrong, let me have it checked out.
Okay. My early symptoms were when I was much younger,
Okay.
but I didn't know exactly it was lupus, because at that time we did not have the information that we have now.
Correct.
But after age 18, I had my daughter at 18. My menstruation disappeared. It didn't come back.
Okay.
And I started getting different. Well, when I was young, I had this stomach issue, kidney issue, little issues in the stomach, but we didn't know it was that. But it became aggressive. I start getting pain, swelling joints, and it's like, okay, what is going on? What is happening? So I started going to different doctors, trying to figure out. First of all, they said, okay, it's the kidney. They said, okay, I maybe have kidney disease. We do the test. We had a little problem with the kidney. We fix it up. I do a little thing. We clean up the kidney. We get it. We go on track. And here I go again with unexplained pain. And
that's
so
overall pain, or any particular area?
the stomach, the body, just overall
Okay.
pain that like you're not supposed, okay, active, I think I'm not supposed to have all those type of pain. So like going to different doctors trying to figure out what is exactly wrong. I did, my hand will turn purple. And as everybody know, for the famous, I always say it's my grandmother because she British, the hand, but didn't know. So the journey began around that time, trying to figure out, okay, what exactly is really going on. The worst time was a morning I got up and I just couldn't get up from the bed. I just
Wow.
couldn't. The foot just couldn't move, swollen big and everything. And it's like, but what could be happening?
Right.
And even I got the
Butterfly
rash
rash.
and went to doctor here. They didn't know
At the
at
time.
the time. So it
Okay.
wasn't
Okay.
it wasn't as so much as like no. So we didn't know. So in going to do further testing and thing, that's how I end up to getting to know that it's lupus that I have. Even though when I did the test, even though you do an ANA test, it come out positive. You cannot say
For
exactly
certain.
it's certain
lupus.
it's lupus. There's how many other different
That
tests,
you
and
can
there
take.
is little symptoms and thing. There's a drawing board. They have the doctors, the rheumatologist doctors have a little drawing board, and you
Right.
have to tick up because remember, fibromyalgia have the same symptom. It can be
Exactly.
that you have and not lupus. You understand? So you have to tick up. Okay, she got the butterfly rash. She got the other rash. You have to tick up the things for you to know exactly. And most people don't go for. Some people never get the butterfly rash.
Yes. Yes.
But they
Very
get
true.
rash on their other body. They never get other things. And they are diagnosed with lupus because after you sit down and you start taking out doing your pointers and going, the doctor can diagnose. It do take a long time, but the journey was a long journey until, but at least right now it's a little easier. It's not
No.
really with I being diagnosed and like forming the foundation and trying to bring the information of what I go through and everything. We try to do the testing and like we have the markers to look
Right.
for. So if you do it, so for somebody it will take a little easier for a doctor to say yes.
A bit sooner
It's
to
yes
diagnose.
than the
Yes.
6 years now. Even in the States, everywhere now, it takes a little. But it have people that will go 6-7 years because the signs are so, but it's so wild
I know.
that you can never
No,
know.
for sure.
Yes.
And this is something to take note of. I love the fact that you brought up the point that, and same as Lee, is that the symptoms may mimic other conditions, which makes it even trickier to really
Yes.
diagnose point blank.
Come back.
Right? So someone may be asking, but how is lupus caused? There is no
Known cause.
known cause. So say, okay, because you have this, you will get lupus. No. There are certain factors
Yes.
that may increase your risk of getting lupus. Some may be genetic. So, for example, if you have a family history of someone who
with a autoimmune illness.
Right.
It don't have to be
Not just
not
lupus.
just lupus. It have to
Right.
be any of the autoimmune illness. That is a risk factor. You're a higher risk at.
definitely. Right. So, right. So, as Glorin said, if you have a family member with lupus, but even without lupus, but you have an autoimmune condition, then you are already at a higher risk than someone who isn't in a family with those type of risk factors. There are also environmental factors. So, the lovely sun
Yes.
that we do enjoy, and gives us our recommended vitamin D or maintain our vitamin D levels, that can be a environmental factor that someone can get lupus from. And you see with sunlight, but we need sunlight. And funny enough, we found as pharmacists that many people have low vitamin D levels
Yes,
in the
in-
Caribbean. So those suffering with lupus, when they go outside, they also need to protect their skin. As you know, as Lee said, that the skin can also be affected by lupus due to the inflammation, and so sunscreen or clothing is very much needed. So we talked about genetic reasons, environment reasons. If someone has some type of infection, so remember, because it is an autoimmune condition where our immune system is already compromised, can you imagine getting other infections or having other infections where your body is fighting against? So you can imagine that will also predispose you to lupus as well. Some medications as well. So it's a variety of factors. It's not just one infection.
Yeah, you cannot
or
pinpoint it and
you
say
can
it's
pinpoint
this.
and say
Yes.
that this is definitely the cause of lupus. We're just going to go through some of the symptoms. Well, Glorin took us through what she was experiencing. So she mentioned about the pain, excessive pain that she was experiencing, stomach, body, but there are other symptoms that are seen.
So basically, something I wanted to mention before I
Mm-hmm.
continue with the symptoms, though, you did say that certain drugs can cause the onset of lupus,
Mm-hmm.
and that is something that, I mean, it sounds so scary because it really can come out of nowhere. Now, with drug-induced lupus, the only difference, or at least the bright side, I guess, is most times with drug-induced lupus, if you stop the medication, your doctor, and you should never do these things on your own, but if your doctor does discontinue the medication, then the condition itself can subside. So that's one difference with the drug-induced lupus as opposed to systemic lupus or cutaneous lupus as well. So just to go through them, there's drug-induced lupus, there's systemic lupus,
Most common.
erythematosus, and that is really what you hear about a lot when we think about lupus, when we talk about lupus, and that's when lupus affects the skin, the organs, the joints, all of this. And then cutaneous lupus would just be when the autoimmune disease affects just the skin. So that in itself might be a bit easier to deal with as opposed to, organ issues.
No, it's
But
not.
you think it's
No, because we
wow.
have people, you still get the pain.
Yeah,
still get the
a lot of pain with
Yes,
it.
a lot of pain with it. Yes, it's just that the SLE is more common and it comes with much more damage.
Yes.
Yes.
So in terms of when we're thinking of lupus, in terms of really serious life-threatening conditions that it can bring to you and maybe even fatal, we most times are looking at the kidney issues that lupus can bring about with systemic lupus.
Yes.
Right. So to continue with the symptoms, so we spoke about the pain and so on. I think we want to go a bit broader as to what other symptoms you might experience with lupus as well.
There are symptoms like fatigue, fever.
Right.
So if you realize that your schedule is the same, you're taking your vitamins, but for some you're not stressed out,
You're sleeping
well, and all of a sudden you feel you're more fatigued than usual.
Yes.
You're exercising, exercising can give that extra boost of energy,
Right.
but you still having that extra fatigue.
So almost like an exhaustion.
Right.
And then sometimes that comes along with headaches. You may be getting random low-grade fevers. So sometimes that really means that's the fevers that come about. You're not sick, you don't have the flu, you don't know of anything else you have, but you just have a temperature. And it may not spike all the way up there, but it's a low-grade fever that stays for a while.
Sometimes it stays for days, months.
And you can have that low-grade fever, almost like your body is working at a higher frequency, so you feel that excessive temperature all the time. And that is one of the telltale signs, because what happens is when the immune system works, it works by, again, you have that inflammation at whatever site you may have. If you have a wound, you don't have lupus, you have a wound, your immune system is activated, it goes to the sites, and inflammation happens to rush in that blood flow, rush in all what you need to patch up that wound, essentially. Now, if you were to take a test at that point, then you would probably see that, the inflammation rates in your body are high because you have some infection. Lupus is this without the infection. Lupus is this regularly. So the inflammation that it causes can trigger those low-grade fevers, steady low-grade fevers. And then also, persons with lupus, especially where the skin is concerned, you might have that sensitivity to light.
Yes.
So it's not just that you get the rash, but you will actually feel that sensitivity to light. You go out in the sun and you feel that discomfort.
And it's not only sun alone. Sometimes the
fluorescent bulbs, can trigger that as
those
well.
Different
right. All of these
so
things.
It's all those
so it's not just natural light.
Just not natural light.
And that obviously would make simple things, certain tests you have to do so much more excruciating.
So sometimes even certain tests. So when you have an infection, your white blood cell count
Count,
would
right.
be elevated.
Yes.
So if they were to do certain blood tests, they would also see that your white blood cells are higher than normal range.
Not only
Actually,
Sometimes, sometimes because again, different people, different symptoms,
yes.
different presentations. It is not automatic or guaranteed, but it has been proven that doing certain tests for people suffering with lupus, you will recognize elevations.
Yes, not only white,
But
both the red,
red
red
blood
and
cells,
white. Yes,
red
so
blood
any one
cells
of them can it
can be
different,
elevated.
yes,
Yes.
elevated. It's different.
right.
Of pleasure.
Exactly. Every different
Yes,
case.
case.
Mhm.
Yes. So
And the funny thing with lupus, when I was doing research, I actually saw low white blood cell count, and it was sounding so counterintuitive because if you have an infection, when your immune system responds, your white blood cells go
Will
up
shoot
because
up.
they're fighting. But with lupus, your white blood cells can try to go up to fight, but at the same time, it's fighting your white blood cells.
yeah, remember.
So the concamilo, it can
Autoimmune.
fight
Yes.
your bone
Bone-
marrow, and when it
Mm-hmm.
fights your bone marrow, that in itself can make your white blood cell production go down. So you might get a test as a lupus warrior and have a low white blood cell count, which is it's a very interesting
Condition.
condition,
yes.
the way it presents, because it's very out of the norm for something that affects that is an immune response, and you have the immune system responding in the opposite way,
Yeah,
right?
yes, and sometimes you don't have no infection and it's just a
Yeah.
flare, and it's like that. But it's
Yeah.
remember, the body doesn't recognize because of the ill of lupus. The body doesn't recognize what is good, what is bad. So you
Just
it's
attack.
trying to help, but it like, okay, you come in, let me kill you, let me kill you,
Yeah,
let me kill you, let me
exactly.
kill
Yeah.
you. So that's why we end up getting with the low white blood cells
Cell
count,
count.
because it's also help to boost it. But come on, it's not either. You're trying to help, but it's not.
It's not really getting.
Yes, it's not getting. Yes, it's a battle. It's an uphill battle.
And even so, with the red blood cell count, because it can affect both white and red blood cells, you can find that person suffering with lupus will have anemia. So
Yes.
they would have
Yes.
low blood count, and so they would have to be taking supplements to help to boost up their iron levels. So it's like a domino effect.
Effects,
yes.
You so you have low red blood cells, low white blood cells. You have to probably do some intervention to
To get
either
it.
bring up your levels or to counteract the effects. As Lee mentioned in the introduction, lupus can affect your brain,
Indeed.
right? And we know that we use our brain to function for memory. And with lupus, it can affect your memory in that you may experience memory loss. Your cognitive function, so your ability to concentrate, to think clearly, can also be compromised. You may also feel a bit dizzy.
Yes, headache.
And headaches as well.
And even you have the little, sometimes the drip from the brain marrow will be dripping out of your
Your
ears.
ear.
Yes, you get all those little type of symptoms. The hear loss, you understand?
Right.
All the different way of like the low white blood cells, it can cause so much issues. Gastro problem,
Exactly.
problem, and you have thyroid problem. You have even over dryness of your mouth, ulcers in your mouth. It's just a wide range of. Just think it.
Is there?
It's there.
More than
It
likely.
can cause it. Yes.
And it's like we mentioned, because it is a condition that affects your entire body, you will get all those variations of symptoms.
Cases.
Yes.
on
Sometimes
different-
you
well,
get it all at once. Some people are unfortunate. You get it at a time. You get a flare. You get everything, and sometimes you get certain. Sometimes, yeah.
Okay, so with lupus, the symptoms, signs may vary. It may be slow onset. It can be very rapid.
Yes.
Some symptoms may be mild to moderate to severe. Some flare-ups may be frequent, may be very seldom. And so when you look at lupus as a condition on a whole, there are many things that you have to take into consideration. The symptoms are not how should I say it? It's
not linear.
is not right.
right.
So many things can happen, and with patients, they vary. Now, another question that arises: am I at my age?
At risk.
Am I at risk? Is it for only babies? Is it for us at our age? Is it for elderlies?
Everybody's at risk
Right.
because we do not know what caused it, and it can be environmental, it can be genetic, it can be you just unlucky.
Yeah.
Anybody is at both male, female,
Mhm.
at risk.
And what you
But-
what
Mhm.
oh sorry.
Yeah,
What you
you-
notice with
sorry.
lupus as well is you have anyone and everyone. So you could be predisposed, but then that basically brings up your chances of getting it. But you could get lupus out of the blue. And like we say, it could be female, it could be male, it could be child. Now, statistically, we females are in the highest risk bracket.
Yes, we are.
So females are about 90% of the known cases of lupus in the world, which leaves 10% for children and
And
women.
men.
Right.
Mhm.
So that is something that as women we definitely have to look into. And that's one of the things I always say. Do not ignore your body. When your
Mhm.
body gives you signs, it doesn't have to be lupus, but when your body gives you signs, you don't ignore your body. Itching, random rashes, all of these things that you look into. And of course, with lupus itself, it kind of targets what the average statistic age wise would be between the ages of 15 to about 44. So that is where you can get onsets. Now, it doesn't mean that people before or people after have not seen it, but that is the mass of it all.
Yes, one of the signs that for research that and also with me is like puberty, especially if you go for puberty early on as a woman, because for me my menstruation came at 8, so that's why my symptoms were so that is one of the things you have to watch in your children. If their menstruation period come early, you have to, because they're going through puberty and hormones play a
Right.
major factor in your whole body system and what illness you go about developing. So you have to watch from that time. You have to watch the different signs and symptoms. So it's never too early or never too late. You see the little health card they give us when we're baby, you keep it. I still have mine. So you keep it. You take notes. You as the parent, you take notes and you encourage your child to take notes. So you have a pattern, especially if they complain with pains. You know, it have children growing, they have body pains. They
Right.
have normal growing
Growing
pains,
pains.
right?
Mhm.
But you will know the difference between the growing pains and those type of pain and the fatigue and you get the hair loss, you see the body going through different changes. Sometimes you're just swelling, then you're coming back. So you take your notes, and I always encourage people, get a book, take a note.
Of course.
So you can go back to that 2020, boy, this is what happened, this is it. So you can know exactly. So you can, when you go to the doctor, it also helps them to diagnose you for what, not as we always say, it's not lupus, but diagnose you with whatever autoimmune illness you might be having. And it's better, they can help you. So once you start with those, take a little note and write it down. And don't be afraid to visit the doctor.
Of course not.
Don't be afraid. Don't never be afraid and say, no man, it might go.
I'm smiling because in our practice, we have many individuals coming in on behalf of other patients or family members and friends, trying to explain their symptoms and asking us for remedies. Now, if you like growing and you are very strict in taking note of what your body is going through, especially if it has been occurring for some time and you've probably tried remedies already and you don't seem to get any relief, then you really need to go in person to your doctor,
Right.
be evaluated. If there are tests or further tests and evaluations that are necessary, your doctors will guide you. Because what happens is someone comes, okay, so I go in on behalf of Leona. I said, well, Leona's having a body rash or she's having some joint pain. That's very vague, you know, and right off the bat, we say, okay, so probably the person's trained themselves. We cannot see what rash the person has, and there may be other symptoms that Leona is experiencing that she did not convey to me.
Right.
And what I may give is probably an allergy cream,
Yes.
or some regular
Yes.
painkillers.
And
Right.
so many other
Yes.
things are important, like the onset of
Mhm.
diabetes, where it started,
How
how it
long?
looked. All of these things are important for us to note.
Not only that,
Mhm.
if you're going for symptom, I don't believe that you should send somebody.
Very
Right,
much
You
so.
in
exactly.
person,
You know
even
what
though
you
you're going to the
feel.
pharmacy,
Mhm.
come and explain.
Of
Never be
course.
afraid to. Well, as Ms. Faith, she knows me. I
Yes.
myself don't have no privacy with my illness. If it's
We are used
wherever
to-
I know this is happening because I know things,
Right.
I come in, I tell you, look this, look that. It's no little hush thing. That is what I'm going through. This is what. Tell me. If they
Right.
tell me, okay, Lauren, even though you know, but we cannot help you, check the doctor.
Mhm.
Bring it to the doctor.
Exactly. And
So that is why in taking the notes, if I know something, I tell you, okay, that's the last time. This is what I did. This is what I think. Can you help me with this?
right.
Mhm.
And then
Yeah.
the main thing is no one can explain better than you.
Right.
Yes.
Right. So, with that being said, if you've been experiencing some of the symptoms that we have explained this morning, please go in. If someone's very young who wants to bring someone just for support and
Yes.
company, nothing is wrong. But when you do reach at the pharmacy or to your doctor, you are your own person. You know what you've been experiencing, and certain questions that the doctor or pharmacist may ask, the company would not be able to answer or may not be able to give
Yes.
that explanation. Okay.
And before we go further, on a note, a good note,
Mhm.
when it comes to the testing and doing different tests,
Mhm.
we Dominica have come a long way. Majority of the tests right now are being done at the hospital.
Okay.
So when it comes to finance, and you cannot do it in the private lab, because before you know it's in the private lab alone. I'm not telling you the private lab is nothing, but on the pocket side, the hospital,
Right.
it's a little cheaper at the hospital. It might take a little longer,
Yeah.
but it's been done. Most of the tests have it. Just a few that you must do it by private.
Right.
But as I have hope that the hospital is working on getting everything like that to
Right.
make it cheaper for everybody.
And as
Yeah.
you've said that, that's a really good point, because lupus is quite expensive and treating lupus can cost you a lot. And what we don't realize is sometimes when we have these chronic conditions, that impairs your ability to work. Sometimes it might be for a week, it might be for months. So all of these years, all of these things play into where you really have to try to use your resources. So I'm very glad, like you said, it's available, at a more cost-effective rate, because with lupus, besides the tests, you have your doctor's visits, you have your medications, and whatever or like outside of the mainstream of lupus, you're still susceptible to getting sick otherwise,
Yes.
especially with lupus, you're susceptible to getting infections, because the fact that your immune system is on overdrive fighting itself, basically, when other infections come in, it has to stretch. And that makes it a bit more difficult for it to fight infections. And some of the medications that may be used for lupus, like, the prednisolone for that chronic inflammation, all of these things suppress your immune system. And what that does is make it easier for you to get sick, right? It's almost like a open door saying, come, open bar, that kind of thing. So you want to make sure that you can really, if we're frugal with spending, we can try to budget down and see where we can get different resources at cost effective rates. And one thing I wanted to mention, because we spoke so much about autoimmune diseases and the fact that lupus almost can look like many of different ones. Persons with lupus, as if they don't have enough. There's a statistic that says about 1 of 3 people in lupus have another autoimmune disease as well.
Yes, not one. They come in twin twiglet.
Right. So like 1 in 3, you may have one. You may have 2 autoimmune diseases alongside lupus, and it's so many different things. Because, for instance, lupus might affect what we discussed. You may have another autoimmune disease, like some people when they're pregnant, they go through antiphospholipid syndrome, and that one is another autoimmune disease that then can affect clotting in the body. And then when you put those two things together, clotting and inflammation, it's a whole mess of
But
things.
not even only that alone. Just with lupus alone, forget about the other autoimmune disease. Lupus alone, according to how it attacks your body, you have to get a doctor for the brains.
Right.
You have to get a doctor for the eyes, the mouth, the skin,
the kidney,
the kidney,
the stomach.
you have to. You can. It's just not one doctor.
Right.
You have to have a whole
You have a
range
So
of
it's a
team.
team. A
Mhm.
team.
and in that team you have to keep each doctor up to date that this
With
one do
every-
this, so because
Yeah.
with all the different kind and they give you medication, you have to make sure that this medication they're giving you is not going to interact with this other one with this and things. So it's like
Mhm.
it's a whole journey, a whole work
Mhm.
plan. You have to be on top of your game, and
Indeed.
yes, it's
Mhm.
like getting your master's degree.
Right, right. So you get so knowledgeable as Gorin is because this is your life. And
Yes.
you know, these are the things that you go through. So most importantly, straight off the bat, when you experience these things, you educate yourself. You can ask your doctor to help educate you. You can get a lot of sites. I know lupus, there's lupus.org, which has so much good information, all of these things that can give you not just statistics or numbers, but actual ways to aid your situation if you're a lupus warrior. And one of the things that you mentioned, it's a team, and the good thing is you have all your doctors on island, right?
No,
You have some overseas as well. All
mostly
right.
it's overseas.
You see, so this is such a complex, thing. And with your history taking, you need to be so down to the T that you ensure that every doctor visit you go to, you have, if it's a copy of the history, a copy of your test results,
Oh yes,
all of these
all of
things,
this, yes.
so that they can treat properly as a cohesive unit. And then one of the things you mentioned with medication, there's the medication interactions, but even besides that, medication, when it's cleared out of your body, your liver and your kidneys do a lot of work.
Yes.
So if
Mhm.
with lupus, it's very much so attacking your kidneys, and you
And
have some form of, kidney issue,
Yes.
or you develop kidney disease or kidney failure, all of that has to factor in with your medications, because you might not be able to take medications at the dosages you used to, because that in
Right.
itself can do more damage to the kidneys. So I feel like I will ask if it's safe to say your kidneys, like they're like a prize for the lupus condition, isn't
Yeah, the
it?
price. But what I do, I
Yeah.
detox. I do
Okay.
detox.
Okay.
Yes,
So it
I've
helps
learned
with
that
it.
over the years. So you
Mhm.
clean the liver, you clean the kidney, you clean your urinary tract.
Right.
We do detox. Most of us here on island,
Mhm.
we do detox because our little group we have, we do talk about one another, and
Mhm.
anything like a doctor advise me or treat me, because my condition is severe, very severe, because of all the other stuff I
Issues
have,
that you
issues
have.
I have.
Mhm.
So when I'm taking the medication, I do have to try to clean myself because if you don't do that, you end up on dialysis.
Right.
Yeah, the kidney cannot function,
Cannot
do. So
manage so
that's one of
many.
the. So it's a whole regime living lifestyle. So you have to your illness, you have to pattern your lifestyle on your
Based
illness
yes,
and
around it.
enjoy life.
Indeed. And that's
Yes.
still possible. And that's something we want to tell
Yes.
persons, that if you do this right and you take your illness seriously, get the help that you need, you can still enjoy life. You can still
Yes.
travel. You can still possibly work when your body is functioning as it should. You can make a life very enjoyable, just like any other average
In the
man,
best way.
in the
Yes.
best way you
Yes.
possibly can.
I want to stress on the points that Glorin made, and it's not just for people suffering with lupus. In that, taking note of your medication regimen, your medical documents, your symptoms, your history, your medical history, keeping them close at hand would be very crucial in further diagnosis in the future. So I know some people still don't have medical books, but I always opt for medical books because doctors make notes.
Yes.
You can flip back years before and see what happened. There are different tests that were done before, and you can actually refer to that.
We're not tripping you with the medical book right now. We are in a model age.
Technology,
Well, I mean, if you
right? You have
well,
that
okay.
too.
Well, if you do have another option
Mm-hmm.
in safeguarding and recording, wonderful. I'm all for that. But you need to have some type of system in place.
Right.
You
Especially if any
understand?
scans or whatnot you do. Your
Right.
phone, you have a folder. You can have all your scans in there. You can put it together by date. You can put it together by year. So you can
Right.
just pull up, search, reference, whatever it may be to get your information.
Nice. Okay, so we're going to take a short break. Please stay tuned. Please tell someone who suffering from lupus, or just to spread the word that Health Vibes is talking about lupus and giving out some great information. So stay tuned.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Langdo with co-hosts Jacinta Fegandifo and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday. So be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way.
Introducing Jolly's Pharmacy, brand new website, www.jollies.tm. It's your time to jump the line. Shop now at jollies.tm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.tm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. www.jollies.tm. Jollies Pharmacy, leading the way in healthcare.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Langdo with co-hosts Jacinta Fegandifo and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday. So be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way.
We got this morning feeling mystic. I had the patience to call in sick, but I end up in Jolly's Pharmacy. Great and out in the street, Jolly's fix up my immune system. Got me feeling fit and strong. Now I'm ready to work like it's on any mission. If you see me again, Jolly's Pharmacy is number one. Jolly's again. We cater for everyone. Jolly's again. It's up the immune system. Jolly's again. Yo, Dominic, it's about the box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
Oh, and in the same convenience, you make a big difference. Then you can trust me. I know just where you should be. That is JP Mega. The one-stop shopping, nigga. You could be shopping and having fun. If you're not happy, if you're social, it's to everyone. What a happy place. Oh, JP Mega. The one-stop shopping, nigga. You could be shopping and having fun. It's to everyone. What a happy place. Oh, what a happy place. But just click some more any item and you automatically qualify for discounts. Check us out at the Mega Store in Fongole where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
Okay, good morning once again. If you are now tuning in on the big station, you are listening to Health Vibes brought to you by Jolly's Pharmacy, the pharmacy that you trust and is family to you as well. Today's discussion is on lupus, and I have my pharmacist with me, Leona, myself, Jacinta, and my dear guest, Glorin, who is a warrior, as she describes herself, with lupus and also CEO, founder, president of Dominica Lupus Foundation. So everything in one. So we spoke about what lupus is, the symptoms, causes, what one may experience as well. Leona closes before going on our break, giving us a little encouragement, because I'm sure someone listening saying, oh my goodness, all this someone suffering with lupus has to go through all those tests, and my whole body hurting me and my headache, and so it can seem like it's a lot. It is a lot. I'm not sugarcoat it. It is a lot, but like Leona says, you can live a nice, healthy life.
Indeed.
So right now we're going to speak about treatment. So how can we help the body, and how can we alleviate some of the pain or symptoms associated with lupus?
Right. So lupus treatment, well, I'll talk on the medication side of things because there's many different things that you can utilize. But with medication, when it comes to the first part of it, so you have that inflammation. If it's with the joint pain, the inflammation, the mild arthritis, or the low grade fever, they might start you off on NSAIDs, so that's non-steroidal anti-inflammatory drugs. So you might have stuff like ibuprofen or naproxen. Now, sometimes the pain might be so great that this does not aid as well. So they might up you to different types of pain relief medication that you can take prescription wise. Now, also, funny enough, there's a very well, it's popular in the lupus circles, an anti-malarial drug that is used for the treatment of lupus, and that would be hydroxychloroquine, which a lot of patients with systemic lupus have been somewhat familiar with. And what that does is to help with the rashes in the skin. It helps with the excessive fatigue as well, the joint pain, and also preventing flare-ups. So it's something you would take regularly as one of your daily medications. Now, with corticosteroids, so these can be used for if you're having a flare up. So if you have acute flare-ups, or if you're having some severe inflammation, swelling, like Green said, sometimes you get up and you're just swollen up and all these things. So you can use medications like prednisolone, which you might see a lot with lupus patients as well. And if you have any organ threatening complications in terms of inflammation, prednisolone is given as well. Now, with the prednisolone, all of these things again can suppress the immune system and make your immune system, work less. I mean, it can function less than it's already functioning. But so all of these things, when you're on them, or if you're having a flare up, then you kind of make sure that you give yourself added protection against any bacteria or germs that might give you some form of infection. Immunosuppressants are also used, and during the break, we were just, talking about how puzzling this is because it's your immune system attacking your body, and your immune system is necessary to basically stay alive and keep you, fighting against regular, normal, everyday infections. And we have to now take medication to suppress the immune system, which is already not functioning properly, so that we don't have those major flares. So we're trying to deal with the flare up by suppressing the immune system. So at that point, you are most vulnerable to contracting other forms of infection. So those medications might be like methotrexate for that severe or joint or muscle involvement. Also, azathioprine, we use those for maintenance therapy, especially if a person has what you call lupus nephritis. So that's when the kidneys are affected, really affected in lupus. So that's lupus nephritis. You might notice things like mycophenolate, and that's used in lupus nephritis as well. And if there's severe organ involvement with lupus, so we're talking severe organ damage, and again, we talk the lungs, the heart, the kidneys, the brain, you might have to use some cyclophosphamide as well. In more recent times, biologics are used too. I'm not sure if we have these on island, but those can be used, right? So you might not necessarily get it on island, but if it's something that's prescribed to you, of course, we can facilitate bringing it in for you if they decide that that's a part of your regimen they want to expand into. But that's used when you have severe systemic lupus, and if you have lupus nephritis as well. So all of these things. So it basically the lupus at this point, and that's something that we don't think about. You have medications that probably might help today, and depending they might not be as effective at some point. So if it's unresponsive to standard treatments, then we have to introduce like these biologics. And of course, supportive treatments. Sometimes you might need some vitamins to supplement.
Plenty vitamin
For
supplements.
sure, to supplement. So we're talking vitamin D and calcium. And remember, we spoke about earlier that lupus tends to love your bones and your bone marrow. So when it attacks your bones, attacks your bone marrow, that hinders how they work. So red blood cells can be made, white blood cells can be made. Your bones itself, they're leaching, they're getting more fragile. So you're more susceptible to fractures, breaks, all of these things, right? So, and of course that might hinder your motor skills. So these things we get vitamin D and calcium to help with. Depending on what lupus attacks, you might have cardiovascular or your peripheral arteries, all of these things, issues with these. So to manage, let's say lupus nephritis or maybe steroid induced hypertension, that's one of the things that we don't look at as much. So you need steroids to treat lupus because of the chronic inflammation, and that long-term steroid use can then trigger
and the body. Yes.
That can trigger other things, so you can get a lot of side effects from it. But then again, with medicine, sometimes it's benefits outweighs risk, so we need it. Yes,
What I say, want to care, want to kill, want to care, want to kill.
Yeah, and that's the sad part.
And there's the other thing, like for me, I'm on chemo maintenance drugs for my lupus and all my other conditions. So that's the option I happen to. That's the only thing that could work for me in the States, even though the body now is rejecting it. So I'm at a
transition,
trying to figure out
how
to balance what else we can try. But there's new drugs on the horizon, but for anybody with lupus, if anytime any test you had that your kidney was touched or any little like it was nipping at your kidney, you won't be a candidate to be on the trial period for it unless it is properly approved and thing. That is when you can get it. It's quite expensive still, even those that are approved, it's quite expensive even to get into Dominica. And we don't have insurance here really that can cover the costing for those type of drugs. If you happen to get into a program that, like for me, fortunately, because of the costing of the thing, I write everybody, and I happen to get into a program that covers some of my treatment for me, which I am thankful in this state. So that's one of the things. That's why I tell people also, even though you're sick, no matter, I not only based on it, no matter what illness you have, never to think to write and ask the different companies that you see doing the research or you read about doing research. Write them and ask. You can never tell what helps, how it goes, where it comes about for you. So you write and ask, because where all fails, every other didn't know, as you call all the others. I started with that, the body rejected. So that's what I end up bringing it down where I spiraled because we're trying the little things we have, it's not working. So we have to go step up the game and step up until, like, even with the step up right now, it even the body, even with the flare and with the condition, it's even rejecting it. So we're gonna draw back to the drawing boards.
And I from what you're saying, Gloria, it's a continuous effort.
Yes.
And again, giving hope, to those as well in your shoes, that although it is not an easy condition to deal with, you need to have some type of hope.
Yes,
and also explore your different options, your different resource centers, and what's available to you, and go even a step ahead, because people may say, well, Dominica doesn't have as much advanced, technology or resources, but going ahead or outside of here and doing your own investigations, contacting the necessary foundations. Okay, I'm sure out there, but there are foundations out there who give support, whether it is financial, whether it is moral support, whether it is education-wise, so you really have to take it upon yourself to do the necessary extra work.
Yeah, not because this one tell you no, you don't target the other one, because remember, you're fighting for yourself.
Exactly.
You have to fight for yourself. And in turn, when it works out for you, you can go, Jacinta, I tried that company.
I know.
Right.
Try to.
Yes.
Not gatekeepers.
Not to just share it. Yes.
Exactly.
And with me, that is what I do. I try something, I see it work, especially for treatment. You may not be candidate, but try.
Of course, you
will
can never tell.
They might tell you, okay, we cannot do that for you, but we can do that for you.
Yes.
And even though it's in Dominica, we are, and most people say, but I don't have access to the US. I don't have access to England. It is open.
Yes, exactly.
It's you ask, you write your case, you plead your case, and like if you just let's say you commit a crime and you go to court, you go to court, you plead your case in front of the judge. You just say you're not guilty. You don't go out. So that's what you do. You plead your case. You put your case outside. You put your story outside, and you sell it, and you tell them, okay, this is what you do. I need the help. I want to survive. I want to live. Like my goal is 150. I want to live. So I will. I mean, it's not possible, but I want to. So I will go out there. I will go out and do it. I will write my thing. I will do my thing. I will find out to sing. Even there's one of the drugs last year. I got it, and then after it so happened, it had it by Quick Care. She was bringing. Dr. Martha was bringing it, and she couldn't bring it. I watch the number, I call the people, and then myself, I write my email, I write my story, I write my thing, I write them, and I get it coming directly to me to Dominica now. Yes, it's expensive because it costs a vial of 60. It's almost $200 US.
How long that lasts?
A month.
Okay.
Wow. Right. But I get it. Right. I work it out. I write them. I ask them. I spoke to them. After I finish, I call. I say, okay. I sit down, I pray, I call, I say, okay, I need it. Because I couldn't walk. I was losing my mobility. I needed it to help me.
Yes.
So I put, you have to put in the work. You sacrifice and you make the call. Don't feel no way, don't feel embarrassed. You call and you tell him, okay, this is your situation, this is it, this is that. And he sent it directly to me.
Right. And you mentioned being embarrassed. I think that's one of the things that can benefit most people. If you need counseling, and you should, I don't even think it's if you need. If you're going for any form of condition, check in with yourself and do that by giving yourself a visit to whether be a counselor, a psychologist, or psychiatrist. Speech therapy helps so much. Talk therapy, helps so much. And it's important that if you find the support systems. Right now, Gloria is here and she's telling us about the foundation. If you feel, or if you're newly diagnosed, if you don't know, find yourself there. Find yourself with people that can sympathize with you, people that really understand what you're going through. And of course, never write off professional help. Counseling.
Yes. 100%. That's the guy. Every 2 weeks.
Yeah.
Nice. You have to deal with up there because with what I go through, you have to be strong. You have to be strong. I have to sit down and talk to you and tell you, okay, how can I handle this?
I know.
Look, this is the new symptoms. Like right now, I'm going for environmental flare.
Okay.
Our weather in Dominica is bipolar. So if it decides to rain right now, I'm in severe pain. I get the swelling. I cannot my urine back up, my stool back up. I cannot pass the urine, and so this is like come on, with the pain and the thing, even the morphine, I'm allergic to the morphine. That's the only option, and I'm allergic to it. So I have to take something to counteract
all of these things.
But even with it, it's still not stopping it, by just cutting off the pain. But the thing, come on, you have to say, you have to go on. You have to you don't have a mental illness, but you need the mental help to be able to go for that.
One thing you spoke about candidacy for like the programs that you're looking through. I just want to clarify because it was really interesting to me. In terms of the kidneys, it's just testing. But if you do have kidney issues because of lupus, you would still be a candidate?
No, they don't take a chance.
So that's persons without lupus nephritis?
No. Yes. Or even I don't have lupus nephritis, but anytime you do a test and anything of because they ask for all your records and you have to be truthful to them. So I don't waste time. I send everything for them because I really want to get the thing. And I have to say, I don't see my illness as a curse. I see it as a blessing because, yes, I'm going through plenty, but look at how far we have come in Dominica with lupus, with the information of lupus.
Right.
So anyhow, the kidney, anytime a kidney test come out with anything and you have to do any work, they won't because the drug, remember, is trial drugs.
Right.
It's going to put more work on the kidney. Right. Exactly. So you cannot, until it's not approved and everything, and they know the thing, you cannot. So that's why I even encourage other people in the foundation that when you get it, I send it to them. Try it. Write them.
Right, of course.
Anybody else come to me, I tell them, okay, write them. Try to see. And they take any one of the programs, no matter where, Germany, where thing, is for internet and thing, they take you.
Okay. Okay.
They take you. If they have to bring you up,
They
they
will,
do their
exactly.
paperwork and everything. And they
Mhm.
right now they are looking for people in
For
the Caribbean
Caribbean.
because
Okay.
they want to help the Caribbean people, but people are kind of like afraid to even give their
Yes.
story.
Yes,
That's
yes,
why I've
yes,
been
yes.
encouraging everybody.
Or sometimes you
Give
feel
your
like your
story.
story might be lost among so many
Yeah.
other stories, but everybody has a different
Different path.
pathway, and you might just fit into exactly what they are looking for.
Mhm.
And race has a lot to do with lupus as well. So
Oh,
you
yes.
mentioned the Caribbean. We noticed that a lot of Spanish, Hispanic people, Black people,
Yes.
all of these are more susceptible to contracting lupus as
But
well.
but even so, like Gren said, you want the help for your body.
Yes.
So being embarrassed should not be a hindrance to
No.
you getting help. Thank you so much
Yes.
for that. I mean,
Yes.
I'm sure our listeners are very appreciative of your in-depth personal experience, and it's really an encouragement to those listening as well, and for us as well. And Gloria, something else I want you to let us know and inform our listeners as to how to live a healthy, safe life with lupus. So, what have you been doing? Because Gloria looks lovely. So, those viewing on Facebook can see that, but those listening that don't have that, privilege. But she looks wonderful, and if you see her on the road, you'd never tell she's going for anything. So, Gloria, walk us
Thank
through.
you very much. It's I came up with my own pattern and my own thing because I really was trying to fight the game, but the game was beating me.
Right.
It was beating me. I was losing. So I make I would buy different oil product, make my thing to help with because not all the sunscreen will go with me. So you have to try to make your own thing to help your body so you can go out in the thing. You have to know the different your levels of vitamin. You don't have to wait. If you know the regular testing you do, you don't have to wait on the doctor to know. So you could go to any of the labs and them and ask them to do so you can check on your all your vitamins level because that's one thing lupus do. It strip not lupus, any autoimmune illness. It strip you of all your vitamins. So you take your supplements. You know when you're too much, so you can cut down. But if you're too much, you go to the doctor to help you to bring you down to a level. But you do your basic liquor vitamins. You do your medication. You do your treatment. You can dabble dibble in with me to clean my system. Sometimes I cut down on certain to help and I do my detox to help myself to clear my system and then start back my thing. You I am here right now. I'm flaring. When I'm done, I'll sleep for the rest of the day because the body need it. It cannot do more. I cannot advise anybody on diet because I do not know nothing about diet. I'm being honest with you. I eat right. I eat healthy.
Right,
I
that's
eat
important
mostly
too.
everything on the face of the earth. If my body rejects it,
Then
then I
You leave
leave
it
it
alone.
alone. Okay, I leave it alone. But I eat it in portions. So it's
Moderation.
yes, moderation, and you know your body. Talk to your body, talk to yourself, and that is what I do. I sit down, I talk to myself. I do take as I tell you, my mental health. I take it seriously, very, very seriously, and that is one thing. You have to treat that mind for that body to be able to cope
Need the will
and
to
deal
fight.
and will to fight with it. You even for me, shoes to put on shoes. Sometimes I need help. Clothing, I need help to do all that for me. I try my best to try to do certain little
For
things for
yourself.
myself. So I try to get clothes that I know I can just
Slide
flip on.
over.
That I don't have to come and ask you. You can do that for me. You can do this for me. You watch everything you do. You take care of your hair. You do the different treatment to help you because hair loss is a major factor with lupus. Even with the treatment you're taking, for me, the chemo treatment, yes, it's for you 24/7. So as I do, I have a certain hairdresser that she get a thing from I call it Obia in a bottle. I don't know how it not once I stop it, the hair breaking. Once I two in, the hair don't break. So I call it Obia in a bottle. And anybody ask me, I tell them go to an answer for Obia. That's exactly what they do. It works. So you have to just learn your body, learn your pattern. As I tell you, write down. So you can know, okay, but today I did that. And that work, let me tell you. And also with that, when you go to the doctor, you say, Doc, that is what I do. That's what, because even in the beginning, when I was Dr. Mark, after the full diagnosis, he would give me medication, the pain would do things. So even with that, it's not right to do, but I used to experiment that. So I'll come back and say, Doc, look that I do. I took that at that time, I did this at that time, and that is how it pay, how I felt, how I think. He tell me, okay, let him do his research, and after that, yes, it can be taken like that. So I'm going to prescribe it like that for you for the time. So you have to do your little homework. As I tell you, it's a master degree you're going for. So you have to work do your work, put the work in so you can think, and you have to continue working even though you get the degree. Remember, you have to continue working in the field for you to update yourself, because everything changed. You learn 1 + 1 today, like as the Prime Minister says, 5 + 5 is 55. I never know that, so I learned that right now. So it's that you learning. So this is that. So right now you have to know the 5 + 5 have to make 55 for you. I think if all you'll be right. So you learn it, and that's how I have been going for it. When the body get up and it tell you it cannot, don't
force it.
Right.
Don't force
And
it.
that's something that we do as a people, and not just a lupus. Sometimes you feel guilty. One day you wake up and you're always at work, you're always going to work, you're on time. And you wake up one day and you feel so off, and you push yourself and you go to work because you don't want to miss a day, and you work like that for weeks. And then your body just tells you, no.
Yeah, and when it's shut down, you shut down and it's done.
And sometimes, the shutdown doesn't have to happen with those little things. You have to pay attention to it. You have to give yourself some grace. And that's what we don't do as a people, As hard as we work and as hard as we push in what we need to do in life, you need to be one with your body in the sense that you can identify when something is not normal, it's off, right?
Well said.
And don't ignore off, because sometimes I remember when I got COVID, I couldn't describe anything I was feeling when I just got it. And I was telling something, and I was telling them the only thing I can say for sure, I cannot tell you something hurting me. I cannot tell you I'm coughing, but something off.
Yes.
And I had to test 3 times, like within a week. But 3 times. On the 3rd time, lo and behold, I had COVID. So when you notice something is off with your body, really do what you need to do to figure out what it is. If you're exhausted, you're going to need some rest. Don't push beyond your limit.
Your limit, yes. I learned it the hard way, because I was like, okay, Glorin, yes, you can. But yes, you can tell me, okay,
sit down.
I'll put you down for 6 months.
And you didn't, it did exactly
right.
And that's a long time,
That's a long time. I end up, yes, okay, Glorin, let's do the thing. The mobility gone. Couldn't walk, couldn't think, put you down. So I've learned that, Glorin, pace yourself, do yourself. And worrying, Papa Med, do not worry. It's one life to live, one death it have. Do not worry. Worry, stress is thing. You don't have the money to pay for it. Sit down on your knees, pray, and just let the Heavenly Father make it open the doors for you. He will never leave you down.
No.
And I have learned that he will never ever leave you down. So don't worry. Don't take stress on your account. And see, yes, people just watch, but that's it. Is that?
And the stress can trigger your flares.
And when it triggers the flares, it's even worse. And family support
is important.
Of course.
So our time is very limited, but Glorin, I want you to quickly tell us a little about the Lupus Foundation, where it is located. If there's an office, someone can just come in and get a little support information. And also, I know that there's a forum happening on the 31st of May. So quickly, just go through the 2 areas for our listening audience, please.
Yes. Okay. We don't have a physical office thing. What we do by WhatsApp.
Okay.
So our WhatsApp number is 276-0518, which is still our normal phone number. So you can reach out to us like that, or lupusdominica@gmail.com.
Say your number again, please.
276-0518 or lupusdominica@gmail.com.
Okay.
Yes. And JCI, in collaboration with the Lupus Foundation, we're having a health symposium on the May 31st. That's the ending of lupus month, because May is lupus awareness month.
Mhm.
But that doesn't mean our campaign stopping
Right.
there. But for the month of May, we do a little more activities. And right now, with their help, between Day and BPW will be extended to other months to do different activities. But we have a health symposium on May 31st, which is at 7 p.m. It is $30 for registration fee.
Okay.
It's online, it's on Facebook, so you can look on the Lupus Dominica Facebook page or JCI Facebook page. If you're not available to come, there's also a donation thing. You can also donate. You register, you donate, and you can come. We will have Miss Shoya Gay Grant
Right.
Massicot, a guest speaker. We have Dr. King, Addis King. We have myself, Mr. Glory Thomas. We have JCI Senator Mrs. Hyerson. Hyerson, yes. And we have Shakir Winston and Dr. Dillon Hippolyte will be the hosts of it. So we'll be talking basically what is lupus, living with lupus, and how we are coping with lupus, and all the different things you can do to have not a better life, even though you're sick, how to live a better life with your illness, and how to accept your illness and be in the proper mental space that you can enjoy life.
Right. So I think that's a very important forum. It's open to the public.
Yes, everyone.
And it's 7 p.m. So that's a Saturday?
Yes, that's a Saturday.
Right.
Yes.
So it's a weekend. And many people have a little more time on a weekend. So I'm really urging our viewers and listening audience, and those suffering with lupus, someone who knows someone with lupus, and just anyone who wants to get to know a little more about this condition and ways that they can help people suffering with lupus to be present, to register. And if you cannot be there in person, make a donation. It can help someone suffering with lupus. So there are so many ways to help and to support. Before we leave, I really want to thank you again, Glorin, for being here with us today. We really do appreciate your presence, your information, your guidance, your personal take, and giving all of us hope, not just those suffering with lupus, but all of us hope in pushing forward, in persevering, our word resilience since Hurricane Miriam, being a very resilient people and taking care of ourselves.
Indeed, I think this topic is one that is not talked about enough. And it's great that for the past few years, we're learning more and more about lupus. We're hearing lupus more regularly, in regular talk. Because some people might still not know or have ever heard the word before. But I'm glad that the awareness is spreading. And having heard even more of your personal story, we've been working with you for years, Culture too. And hearing so many things that we didn't know. It's really inspiring in terms of how motivated you are to push forward, with the Lupus Foundation and getting help for everybody that needs it, not just herself.
Yes.
So that's very admirable. Also, I would just like to say as well to all our listeners, I think a very big thing to take from this is your health matters. Generally, it's important that you're personally involved in your healthcare plan. So that means taking notes of everything that happens health-wise, also taking notes of how you feel both mentally and physically, and that's good. We should do more journaling, these kind of things. It's good to know what's going on with you so you can clearly identify changes, making sure that we have a primary healthcare doctor. And I'm not saying when you're sick, you have a doctor every year. You just do your regular checkup. If you are sick, then you go to your doctor, but you have a primary healthcare doctor that you can go to. You might take regular blood tests and everything, and then they notice, hey, this person looks anemic, and let's look more into that. Or hey, this person has this protein here, these kind of things. All of these telltale signs of different autoimmune diseases, different non-communicable diseases as well. But I just want us to take from this that your stories we're fighting for, whatever it may be that you're going through, whatever condition that may be, really trying to show you, the strength that you have inside of you. And it's important that you try to make the best of whatever conditions that life has, thrown our way.
Amen.
Thanks again for having me. It was a great show. I enjoy it.
Yes.
Indeed.
Yes, and
Certainly.
anybody, I gave you the number. Feel free to reach out to the number. I'm willing to help everybody. One thing I only want to everybody to people who understand. Sometime I'll tell you I cannot, because if I'm going through anything mentally, you don't get my best.
You cannot give what you don't have
I
at the
can't,
moment.
right. At the moment, I cannot give. So just bear with me. If I tell you I'll get back in touch with you, I will or I'll put you on to somebody that is in a better position
Right.
to
To
help
assist.
you.
And that's a very important
Yeah.
note. And generally in life, you have to set those boundaries for yourself when you're going through stuff. Because the problem is, if you try to engage when you're not fully there, it's either you may engage badly, you may not necessarily be at your best self to give the best advice, and of course that hinders your healing as well.
Exactly.
So in every state, in every fraction of life, whether it be work, whether it be health, you need to know what your limits are. Like Gloria was saying, she pushed and it sit
Send
down
her
for
down.
6 months.
Yes.
So to avoid these things, you do have to make those boundaries. And it's always important that besides external help, you do your research, you get educated,
Yes.
because it's available for us. That is one of the good uses of the internet.
Yes.
That we can.
The master degree, you do the research,
Right,
go
for
it.
sure.
Yes,
And we are
so get
continuing
this.
education, people. We get our degrees in whatever it is that we're facing in life, and we
Yes.
always have to continue to learn.
Yes.
Okay, so well said. There's nothing more to add. I think we've said all that we can at this point.
Indeed.
And I really hope our listeners and viewers took away something useful, valuable, and learned something new this morning. So signing out from Jolly's Pharmacy. Have a wonderful week. Stay safe, stay healthy, stay loving. Take care.
Indeed.
Guys, thank you so much.
Yeah. No problem.
Thank you, Gloria.
Very much trying to make me cry.
You understand? Right?
If you read my side, do this stuff.
Brand new website. www.johnny's.gm. It's your time to jump the line. Shop now at